Hello again, and welcome to Tustin Longevity's weekly Wednesday morning, 9:45 in the morning. Ask the Integrative Doctor any questions. We don't restrict the questions. You can ask us anything, and we'll do our best to try and give you what a functional doctor, integrative doctor would do to approach your particular question. This is general advice. It's not meant to be any particular medical advice. And what we like to do is we're recording these things to let you know how we clinicians approach healthcare and solve problems. We enjoy very good results at our clinic, and I thank the Lord for that. We have such a reduced prevalence of new cancers, reduced prevalence of heart attacks, reduced prevalence of blood clots, reduced prevalence of diabetes onset compared to the general population trends. That's because I think we as integrative doctors sit with our patients and we work on what really makes the difference, and that is lifestyle challenges that you need to correct. I need to correct, my family needs to correct, we all need to correct. And so as we talk today, I think as the primer to wait for some of your questions to come through, I'm going to talk about why we use Juice Plus. One of the things I keep on talking about is oxidative damage. Another term for oxidative is pain, inflammation. So when you're hurting, when you damage your cell membranes, and it all boils down to your individual cell membranes that make up any tissues in your body, whether it's a bacteria attacking your tonsils or sinuses, whether it's a virus attacking you, whether it's if you have bad habits of smoking or drinking alcohol attacking your liver cells, heavy metal toxins from our environment because our airplanes, foreign countries don't have the EPA controls that we do, and they'll be expelling lead and mercury into the air. So we have a lot of oxidative stress every day of our lives. Emotionally, we have stressors. We have electromagnetic energy stressors, and all these are damaging our cell membranes. So we spend a lot of time with our patients talking about trying to stop or reduce the amount of cell membrane damage and how to repair this. Also, we're published in this. We do a lot of work in publishing the results of our patients' improvement in reducing oxidative damage. So what I'd like to say is you and I are living our lives, and we'd like to extend it in a healthy manner. We don't want to be in a nursing home or assisted living. We'd like to live vibrantly and healthy as long as we possibly can. And when we do that, we are asking our cells to handle the damage of cells being oxidized or burnt or cooked. You could think of yourself as a roast. So you're a roast, I'm a roast, we're all roasts that are slowly cooking, you might say, at 98.6 degrees Fahrenheit. And so we're slowly cooking, but God has given us plenty of things to help with the heat and the waste of that cooking. And one of the important things we're never going to omit, and we make first of every patient visit, is to drink plenty of water. So let's talk about how we at this clinic have found our best way to reduce the oxidative damage, and that is we use our Juice Plus series. Juice Plus, fruits, vegetables, and berries. This is a whole food concentrate. Is just merely food, fruits, vegetables, and berries that are handled in such a healthy process. And of course, I've gone to the processing center. I've done my own research on Juice Plus, as I do many of my nutraceuticals that I do use. And it is the most published nutraceutical that I know of in the world. We have a summary paper that we give to our patients, and I'd just like to point out some of the features of how we know that Juice Plus provides from fruits and vegetables and berries this oxidative protection to our patients, and why we have chosen it in our clinic. One is, if you take a nutrient and you ask the question, do you know if it's going to be absorbed? Well, we have over 20 peer-reviewed publications that talk about the fact that Juice Plus does effectively increase plasma levels of antioxidant nutrients and other phytonutrients. There are 20 peer-reviewed publications on this. So when I recommend my Juice Plus, I am recommending something that I know will in fact be absorbed. Originally, it came out just as fruits and vegetables. I've been using this on my patients for 20 years. I actually did my own individual clinic study back in 1999, published it in 2000 in the American Nutraceutical Journal. And with my patients, I took a broad spectrum of patients, whether they had cancer or depression or hypothyroid, or if they were pregnant, or if they had diabetes. I had a general practice of patients. And in this, I did a test called a SpectraCell. And on this SpectraCell study, it measures antioxidant level of protection. I gave them just the fruits and vegetables at that time, because that's all I had of this, because I wasn't convinced back at that time in 1999 whether or not I was going to use it. And the result was I had a tremendous, across the board, every single patient I gave had a significant increase in their level of antioxidant protection after 3 months. And that's the only intervention I did. So this was an open label pilot study, which I did get published. And so I began using it. Later, they added, close to 10 years ago, the Vineyard, which is the berry food concentrate. And so we have 20 publications now to date on its bioavailability. And the oxidative stress was what I was interested in my research. And there are 16 publications on oxidative stress and redox biology on Juice Plus, which shows that the effectiveness has been measured with exercisers and obese women and smokers and other populations. We have 16 studies that shows that this oxidative damage that you see here from our lifestyles is reduced. So of course I'm going to use it. Now, inflammation is the result of oxidative stress. So tissues will inflame, you'll get edema, cytokines and other things accumulate. And we have 4 studies on that show that it decreases levels of several key biomarkers of inflammation. The immune system, to help the immune system, we have 5 studies published on that, peer-reviewed. In general, we've had healthcare professionals who are always around people who are bringing us the flu and other illnesses. So healthcare professionals, stress law students, elderly population. And we did show in these studies that it increases the number and activity of our immune cells. One of the areas of research that I'm really excited about is DNA and nutrigenomics. There are 7 published studies on the fact that Juice Plus reduces DNA damage, research on nutrition and gene interactions called nutrigenomics, demonstrate that several genes involved in lipogenesis or building fats, inflammation, energy, and insulin metabolism were changed beneficially after using Juice Plus intervention. And so we have 7 studies on that. I know of nothing that has this much research behind it. Naturally, that's why I use it on my patients in our clinic. And this is why I'm explaining it to my patient base. Heart health. There are 7 studies on the beneficial aspects of heart health using Juice Plus. One of them is it maintains helps to maintain normal homocysteine levels. It also helps maintain normal elasticity of the arteries, healthy LDL cholesterol levels, and protects lipids from oxidative damage. We have 7 studies on that. And in particular, one I'd like to note is the Journal of the American College of Cardiology in 2003 made this publication statement. On the back side, skin health. We all would like to maintain beautiful, healthy skin. I've been on Juice Plus 20 years now and recommending it to my patients. It increases the skin microcirculation by 39%, along with boosting skin hydration, thickness, and density. And this has been published in the British Journal of Nutrition and Skin Pharmacology and Physiology. So we have 2 studies on that. So naturally, of course, I'll use it. Even dental health, your oral health, cavities, periodontal gum disease is very important. And they looked at 2 studies published on this about the recovery from third molar surgical extractions. And it showed improvement in gum bleeding and reducing the plaque buildup and the pocket depth of the gum line there. So it helps with avoiding complications of your dental health and surgery. Quality of life. Even MD Anderson did a study using Juice Plus on ovarian cancer survivors, showing that it improves the quality of their life, phytonutrient markers, and cell health. We also have studies on obesity. There are 4 studies published. In particular, one overweight boys using this saw an increase in their beta carotene levels, a wonderful antioxidant. It improved their insulin resistance, and it reduced their abdominal fat content. And it also revealed that cholesterol and LDL reductions were found on these studies, and it increased their lean body mass. So it helps when you reduce oxidative stress, inflammation, improving the immune system, and the various things that it does. It improves the lean body mass. And then finally, there are studies on lung health, improving pulmonary function, especially in smokers. So I have patients come to me and they'll bring nutrients. They're trying to do their best to take something because they understand that the processed food, the fast foods, the high carbohydrate, the fast lifestyles we have are harmful to the body. So they'll go to various health food stores and they'll bring in what they're taking when they see me. And they'll ask me, "Doctor, is this good enough? Is this good enough?" And I'll say, I've been practicing integrative functional medicine closing on 40 years now. And when I see all these people, like in the study I personally did in 1999, 2000, I found that they were coming with all these nutraceuticals and they were taking them, nutrients, and they had poor readings on the SpectraCell. And this is borne out over all these years. And then when I introduced in my personal practice the Juice Plus, I saw tremendous improvement across the board. So when I see the patient, I'm going to say that item they're taking may be a good item. I have no science on it. I have no way to check it other than use you as a study of one. And then often we'll do then some studies, some specialty studies on their antioxidant levels, and I'll see these poor levels by and large. Occasionally there is a patient out there that's doing well, but the vast majority of patients have very poor antioxidant levels and other nutrient deficiencies. So then I start using, in general, for my antioxidant protection, our choice here, all 5 of us clinicians here use Juice Plus, and the answer is the science. The science is established with this, and I, as a physician, have to choose where the science leads me. And so that is indeed why, if I'm going to slow your rate of aging, slow your rate of cell membrane damage, I am going to choose, indeed, an antioxidant that has no sugar in it. You know how much I talk about cut the carbs, lower your sugar, reduce your carbohydrate intake, intermittent fasting, things such as this. I stress this to my patients. And then when I found that Juice Plus has just the phytonutrients in it, and it's a whole food, so it's just taking a food concentrate without the sugar, and I'm trying to reduce my patients' carbohydrate sugar intake, of course, I am going to choose Juice Plus. Now, we also have a handout that we give to our patients. Maybe Blake, you can post the what to do. I don't know if we've ever posted this before, but we will post this handout, I think, if we can do that on the live feed today. And we have a list of things that we talk about what to do to our new patients. And number one is we're living in a country that has way too many carbohydrates and fruit sugars. And you saw my other videos on high fructose fruit sugar and the damaging metabolite of sugar, which is methylglyoxal. So we're saying, please reduce your sugars, your fruit sugars, and the hidden sugars that are in your processed food, restaurant foods. So that's number one. Number two is reduce the processed foods, packaged foods. We learn how to fast, learn how to deny yourself. And we often tell our patients, don't eat breakfast, just have a lunch and an early dinner. So your window of using your gut for feeding yourself is limited to a 6-hour window in a day. Or to do a more prolonged fast, to go 24 hours, where you would go from dinner to the next dinner. The longest fast I think I've ever done is a 5-day water fast, and it's very invigorating. Research is showing that doing twice a year a prolonged fast might in fact be as good as doing intermittent fasting every day of your life. I recommend both. I do intermittent fasting, I skip all my breakfasts, and I do a prolonged fast twice a year. And it gives you many, many benefits. Your body is then able to spend more of its time and immune system focusing on healing other aspects of your body, rather than always dealing with an immunological challenge. Every time you eat something, your immune system is stressed. Eating is stressful. And so the healthier you can make your eating, the less immune stress you'll daily give yourself. We have YouTube videos that we recommend, of course, using ours for our patient base. These are designed to help our patients, so we don't have to reiterate over and over again these things. We can often refer to a YouTube that we've done, and that will help our patients learn and take control of their personal health care and lifestyles better. And that's the purpose of these videos. But we have other videos that we think are very useful. I like Thomas Seyfried, Cancer is a Metabolic Disease, on YouTube. I like Dr. John Whitcomb, Whitcomb, Vitamin K2, the super vitamin, on YouTube. We like Dr. Lustig's Sugar, the Bitter Truth, on YouTube. And we often emphasize the fact that if you're going to stay healthy, make sure, especially in the winter seasons, you're on vitamin D with K2 to help yourself with your immune system. We emphasize gut health. We emphasize getting enough sleep every night, going to sleep earlier, getting up earlier, and exercise with strength training. Number 10, we talk about toxins. We need to learn about the oxidative stress of our current lifestyles, the heavy metals, the polycarbonated volatile organic acids, and other fumes that are challenging us. And we talk about using higher dose vitamin C's, intravenous vitamin C's, for these more organic toxins, and pesticides, and herbicides and fungicides. We talk about chelation for the heavy metal toxicities. We talk about the importance of using enzymes, systemic enzymes, to reduce and get out old debris and damaged cells from your body, and the value of water. Another YouTube that we like to bring up is Coronary Calcification and Fixing the Root Cause of Heart Disease by Ivor Cummins on YouTube. Ivor is spelled I-V-O-R, last name Cummins, C-U-M-M-I-N-S. Another one we like to have our patients tell them to watch to learn about fasting is How to Reverse Type 2 Diabetes by Dr. Jason Fung on YouTube. His last name is spelled F-U-N-G. And then Thomas Seyfried also had another wonderful YouTube called Water Fast as a potential tactic to beat cancers on YouTube. He did a very good presentation on that. So we have about 15 items here that we've listed that are a very good foundation for helping our patient base with regards to setting up a healthy lifestyle. We want to remind you that we can take walk-ins into our IV suite, especially in this holiday season. If you feel you're coming down with a cold, a nice vitamin C drip will help boost your immune system, as well as other choices. You don't have to be a patient here. The other thing is we want to remind you, as the holidays and last-minute blessings that you want to give to your family and friends, we have the gift certificate that you can name who is the recipient of to help them with some healthy choices, or an IV, gift them with an IV. We want to remind you that we have the Doctor's Nutrition Bar. These are designed for doctors, by doctors. And again, we've done the science on this, the human testing, to show it has a very low insulin stimulation and a very low glucose impact on the human body. It's got 15 grams of fiber, 15 grams of protein in it. Its net carbs are proven to be 4. So these are all excellent choices. And I guess that would be our presentation today on our choice over the past 20 years for antioxidant approach and other healthy suggestions for our patient population. Do we have any questions, Blake, at this time?
We do not have any questions this morning.
Well, that's wonderful. So we will take a little earlier break then today, and we will then suggest see us next week at 9:45. Have your questions ready. And I hope that you're safe and getting ready for your holiday season that you're planning for, and you keep your holiday eating to a minimum of these sweets. Please try and keep it to under control and not get out of control, because again, usually the all of January and February is a situation where we doctors are seeing our patients come in and they've gone off their diet and they've eaten foods that they're known sensitive to, and they have all kinds of gut problems. They start getting achy in their joints. They start getting a depressed mood. Please don't do that to yourself. Please enjoy the people and the fellowship, and keep your treats to a minimum, and keep your health. It's something precious to preserve. Have a great day. Thank you.